Welcome back to Dr. Duncan Show, and this is Dr. Duncan. Today we're gonna continue actually with talking about the lumbar curve and abnormal lumbar X-rays because that's important. As we have been talking, we have seen that these are some of the issues actually when we talk to abnormality, which causes a lot of disability with a lot of people. I get to see a lot of people come to my office and they say, well, they're on disability because their lower back is in pain, they can't sleep, they can't stand to walk, they can't sit, they can't even bend, and all these things are important to know what is really the cause of the problem. A lot of times people come and tell me, well, they are on Vicodin, they are on Tramadol, they are in a prednisone, and that's okay, kind of to manage the pain. But I always tell my patients that we're going to want to go deeper than just taking medication for the longest time and find out what's wrong. And one of the things we have also said before, and we are continuing to make sure we emphasize, is that 90% of the time when we look at the x-rays, we can always see where the problem is, what has caused these people to be on disability, what has caused these people to be in pain. And when we find that, then we come up with a plan to make sure that we get our patients better so that they can be more functional, so they can enjoy their social life. Right now is summertime, and a lot of people want to go out there with their grandkids or with their husbands or wives or with their friends and enjoy the sun. But when you're having a sciatic pain or you're having a disc pain or you're having pain in the lower back, I'll bet nobody wants to go out there and walk or go out there and just have fun. And that's why we want to bring this show to you so that you can have a clarity of understanding that there are options there. And what are those options? These options are there by way of knowing how bad your system is. We are talking about the lower back today. How bad is your misalignment in your lower back? And that becomes important. And so in this show, I'm going to want you to focus on something on the screen here that I'm going to be showing you. And this is called the lumbar MRI. That means this is the MRI of the lower back. You can see actually from the previous show we showed about the lumbar x-ray, you can see this x-ray is totally crooked. You can see there's no brainer. This is totally crooked. Now, there's something that I want to make sure that everybody can see. You can see it comes down like this. It comes crooked. It comes down like this. It goes down. So this is kind of a little is going on with what we describe as scoliosis. There is some scoliosis going on here. And what is scoliosis? Scoliosis is very simple. It is basically when your spine has a lateral bend. Meaning a lateral bend, all it means is, your spine is bending on the side. Instead of being in alignment, is bending on the side. And that's what we describe as scoliosis. And so what we are finding it is at the base between L4 and L5, this area here between L4 and L5, lumbar, you can tell definitely there is what we describe as number one is arthritis. There's arthritis that are set in right in here. And that's why when you look at L3 and L4, even though the vertebra is crooked, you can see that vertebra and there is crookedness, but you can see there seems to be a space or a gap between those two vertebrae. But when you come to L4, L5, you can find out there's no any gap between. And actually what you can see is like there are what we call like bone spurs forming on the side there, bone spurs there. And you can see that there's no space between the disc. When there's no space between the disc, then we describe that as arthritis. And so with that by itself, what is going to happen with this kind of a patient, we definitely going to find out probably the symptoms they're going to be displaying will be probably sciatic nerve problem. And why sciatic? Because sciatic nerve is a combination of three nerves that emerge from L3, L4, L4, L5, L5S1. And what is S means? S means sacrum. So when you have pressure in those three foraminal openings where the nerves come out from the spinal cord, going down the legs, you hear people say, I feel like something is going down the legs. I feel like I have a sharp point going down the legs. I feel I have some numbness and all that stuff. All that can be caused in a situation in this particular case because the lumbar or the vertebrae are out of alignment, and because they are out of alignment is causing a pinch in the nerve. And this case here we have a little complication because it is not only the scoliosis effect we are finding, but we are finding that the patient also have arthritis, which is causing the disc to become degenerated. And that's what we are looking here. So looking at this, we are finding some problems and this patient is going to be in pain. Now, there's something else I want to mention because this is important. You'll be amazed how many patients come to me and say, Doc, I can't sleep. Doc, I've been taking this medication. What do I need to do? Normally, what we'll do for this kind of a patient, we start with a plan of making sure we do what we call traction. And we'll traction and decompress this area where there is no space, so that the one thing people don't understand when it comes to traction, all you are doing is basically you are trying to open the space because the space has narrowed. That means there is no ability for the blood circulation to go to the area. Blood circulation is so important in healing because blood carries everything in our system. If we eat a diet, either we eat a fatty diet, the food is assimilated and it joins the blood system and it is able to nourish us with nutrients. If we take medication in the mouth, it is assimilated in the intestines and it goes to the blood. And when it goes to the blood, it's sent all over the body because it's in the blood. And so the number one reason why a lot of people don't get the right and good results with these kind of issues is because there's lack of understanding. The number one thing we need to do for the better healing and for the real deal cause of the problem is to get there and create an ability for the blood to circulate. How do we do that? We try to reduce the misalignment in the joint. That means the joint can start to move a little better. Increasing range of motion, increasing mobility causes more blood into the area. And when the more blood in the area starts to come, then what happens is now the body starts to heal. And how does it heal? It starts to reform those things. If there are cartilage that are totally gone, if that we can bring blood in the area, you can find it is a slow process. I'm not promising for a quick fix, but you can see that, and it takes time, but you can see the patient starts to get better and they can avoid surgery or overuse of medication, which is definitely going to keep them healthier and healthier and healthier. And so given this, I want to make sure that you understand that becomes important. Now, the other thing I'm going to want to make sure I point to you is very, very important, which is connected to the lower back. And I'm going to show you in the x-ray. But these are these O's that I am pointing to you. A lot of times people don't understand. For example, if you have been involved in an accident that caused your hips to rotate, instead of being able to be in the same level, they rotate, and what happens is one hole becomes bigger than the other one, in the sense because of the rotation of the pelvic. That has a lot of consequences with L5, S1 disc, L5, L4, L5 disc. Those can be problems. And so what we are finding is when we look at the x-rays for abnormality, we also look and see whether there is rotation of the pelvic. Because if there is rotation of the pelvic, we can definitely take care of your lower back. But if we don't address the pelvic, then what's going to happen is you are not going to get a full recovery. And so looking at the x-rays here that we have here, we have the same thing going on. You can see this are those ores I was showing you right in there. We have those two ores, and we can see those in the x-rays. Those ores are called obturator foramen. Obturator foramen. A lot of blood vessels pass there, a lot of nerves pass there. But the bottom line is this. These ores become very important because if you see this ore on the left side that I'm pointing at looks way bigger than the ore on the right side. It looks smaller. Now, this reason for this to happen, it doesn't mean this patient has abnormal or congenital problem, meaning from birth. But what it means is there has been a hip rotation. And actually, because of that hip rotation, we see a lot of times in auto accident or slip and falls where there has been a trauma. When that happens, that causes a lot of stress on L5S1. And that's why you can even see this patient L5S1, there's no space in the disc. Actually also causing another stress on L4, L5. We can see there's no space. And that has basically dynamically changed the way the spine looks. And that's why I'm telling you today, definitely, if you have been involved in an accident, or you are there, you have been having a lot of pain that you don't know where they are coming from, I want you to call our office. My number is 248-398-1650. Once again, the number is 248-398-1650. Call me. This is Dr. Duncan with Dr. Duncan Show. And I am here to educate you and make sure that we give you the answers for you, and not for you, but also for your loved one. One of the good things about my practice is this. We get to take care of families. We take care of families. A mother comes and bring the kids, and we get to see a husband comes, and he feels so good that he has to bring his wife, and then we see a grandpa comes and he has to bring his wife, and so we make it a lot of fun in our office because we give people the answers, and that is what we are about. You know, some people have said, "Oh, you are Dr. Feel Good," and I love when people tell me that because I work for them to make sure they feel better. Otherwise, once again, this is Dr. Duncan with Dr. Duncan Show, and I will be see you in the next series. Keep tuned because I have good things for you. If you have any question, you can always visit us in our website at chiropracticworksforyou.com. If you have any questions or you want me to deal with some specific, topics that you want to watch in our shows, just go to our website at chiropracticworksforyou.com, and in that website you can definitely you can write anything you want and send to us, and we'll be happy to answer those questions for you, or we will be happy to talk about those topics that you are really burning to know about. But once again, this is Dr. Duncan with Dr. Duncan Show. Have a wonderful day. Thank you.